Hi, my name is Dr. Michael Corey, and I'm Clinic Director here at Wellness Stop Natural Health Center in Tustin. You're probably watching this video because you or a loved one is currently suffering from the horrible symptoms of fibromyalgia. Do you have fatigue, just chronic fatigue? You're just tired. Halfway through the day, you're ready to take a nap again. You go to sleep and you can't sleep at night. You have insomnia. You're waking up throughout the night because you just can't sleep. Do you have chronic pain throughout your arms, your shoulders, your neck, your mid-back, your low back, your legs, your feet? Does this sound like you? Are you so fatigued and achy and suffering that you're just not your own real self anymore? Well, what I'd like to do is provide you with some hope, because up to this point you've probably gone to your general practitioner, your medical doctor. Maybe you went to a rheumatologist, maybe you went to a neurologist, maybe you went to a psychiatrist up to this point. Maybe you're on Wellbutrin and they've given you some psychiatric medication to slow down those nerves a little bit. So what I want you to understand is that you can't drug yourself back to health. These other approaches from a traditional medicine has not helped you. They've not resolved the core problem because it's symptom-based. Well, what we do in our office is functionally based. We're going to treat you and we're going to evaluate you from a functional neurological perspective, and we're going to evaluate you from a functional metabolic perspective. We're going to evaluate you structurally as well. Now, what I want you to understand is that there's some 5 primary areas that I want to talk to you about that can cause problems with your fibromyalgia symptoms and be the core cause of fibromyalgia symptoms. How we handle that in office is we help you deliver more fuel and more activation to your cells, tissues, and organs so we can upregulate and make sure that we get your cells and your tissue and your body back to health. We do that with fuel and activation. Fuel, oxygen, and glucose comes into your cells, forms ATP, it provides energy to the cells, and the fuel system is there along with the oxygen that you breathe. Activation, on the other hand, comes from gravitational forces coming down on your spine, your nervous system, muscles, tissues, and organs, sending signals back up to the brain and then back down to re-regulate. So we have a right brain and we have a left brain. Both of those have to be in equal balance. Well, the activation portion in our office, we use unilateral adjusting, we use vibrational therapy, we can use auditory stimulation and visual stimulation, just to name a few of the therapies we provide in the office to help you from a brain-based standpoint. So it's not cookie cutter. You can't just take a drug and expect that to be the solution to your problems. So what we're going to do is we're going to look at those causes, and as a fibromyalgia patient, we have some things that we need to look at. The first thing that we're going to look at is we're going to look at the anemia. If you have anemia, then you have oxygenation issues. We can't get oxygen to the tissue. We have to get that anemia taken care of. There's 12 types, and we have to understand and look at, has your doctor run the correct panels? So correct testing is very, very important. Next thing we want to look at is we want to look at your adrenal glands. Adrenal glands are your stress glands. They sit on top of your kidneys. When you're stressed, cortisol levels go up. When cortisol levels go up, it interferes with the circadian rhythm of your sleep, so you're not sleeping at night. In addition, when the adrenal glands are dysfunctional, we're not going to have normal metabolic rates, and we're not going to have normal blood sugar levels. So that's going to go back and affect. The next one that we're going to talk about is your blood sugar. Normal blood sugar should be 85 to 99. If you're above 126, you've already been diagnosed as having diabetes. If you're 99 to 126, you have dysglycemia or insulin resistance. So blood sugar is super, super important. We have to have that blood sugar just perfect and make sure we maintain it. If your blood sugar is off, you can look at it kind of like termites eating away at the nerve tissue in your body. So we want to make sure that blood sugar is just perfect and we keep that in equal balance. Next thing we want to look at is your thyroid. Now, normal level for your TSH, which is one of the primary markers your doctor's evaluating you from, optimal range is 1.8 to 3. 3.0, 1.8 to 3.0. Your lab test range on your labs, when you look at it from the laboratory, says probably 0.4 to 4.5. It's a huge, huge range. We want to bring that in to look at the functional optimal ranges of all of our patients with every lab that we look at. So we're not using this big wide range, we're looking at where the healthy people are. The wide range is for prescription purposes. We're going to evaluate you from a functional standpoint, not a symptomatic one. So that TSH is very, very important. We want to make sure we get in there. Your doctor also in the evaluation of your thyroid is probably run TSH and maybe T4. We have 8 to 9 markers that I run on a regular basis for your thyroid. So it's not about just looking at one little part of it. We want to look at the whole function of the thyroid. And the next thing I want to bring up is the ability for your GI tract to work properly. If we have a problem and we have a condition called leaky gut, your body is not going to get the nutrients it needs through the digestive process to allow for the normal functions of your blood sugar, anemia, keep the adrenals working, and the thyroid. So your gastrointestinal function is very, very important. Part of that gastrointestinal system is we need to make sure and check to see if all of these conditions are actually caused by an autoimmunity. Now from a thyroid standpoint, when we have hypothyroidism, 90% of hypothyroid patients don't even have a thyroid problem. They actually have an autoimmunity problem called Hashimoto's thyroiditis. 90% of hypothyroid patients have Hashimoto's thyroiditis. It's an autoimmune condition. Your body's actually attacking self-tissue. So it has to be tested for properly. We need to do a proper evaluation with you. So there's a big, big area here that we need to make sure that we look at. And part of that inflammation, autoimmunity, we're going to do special testing. Part of that special testing is going to check for your food sensitivities. Are you actually having a reaction to a food, maybe gluten, soy, yeast, rye, oats, milk, all dairy? Well, we have to test you for it. And when we test you for it, we're going to get a clear-cut answer exactly what's causing the inflammation in your body, what's causing anemia, adrenal dysfunction, blood sugar problems, and thyroid dysfunctions. And we're almost like put all the pieces back together again. So if you like the information I provided with you today, fill out the box next to me. We're going to get your information. A friendly staff member will call you within 48 hours, and we'll get you scheduled for an in-office consultation, and we'll send out a free DVD, 30 minutes long, which will give you more information. My name is Dr. Michael Corey. It's been a pleasure seeing you today, and I look forward to helping you overcome your fibromyalgia problems.